about these breakthrough cases. So let's pick up the conversation there with our guest. Let's welcome back Dr. Jurate Ivanaviciene, infectious disease specialist from Hartford Healthcare, St. Vincent's Medical Center, and Dr. Chris Hahn, emergency medicine physician at Mount Sinai Morningside. Again, thank you both for staying with us here. And listen, the fact is that we have been hearing so much about these breakthrough cases, high-profile cases for that matter, not just on would-be Olympians or regarding would-be Olympians, but congressional staffers, aides, an official in the White House, members of the New York Yankees baseball team. So when there are people who are at home right now and they're already on the fence about getting a vaccine and they're hearing about these breakthrough cases, does this make it more difficult to convince people that they actually work when they're hearing that people are getting it anyway in some cases? Dr. Hahn?
So I think, unfortunately, it does probably give them a false idea of the risk of the vaccine as compared to the risk of the disease. You know, if you look at the actual numbers behind, these breakthrough cases, it's very rare, first of all, to even have a breakthrough case. It's especially compared to an unvaccinated person being exposed to the Delta variant, for example. And on top of that, it's extremely rare for someone to be hospitalized or basically a zero chance or near zero chance of dying if vaccinated. So when you have these breakthrough cases, it does not lead to severe disease. And on top of that, people that are vaccinated do not spread the virus as effectively as unvaccinated people. So you're still not going around and spreading the disease around your community the same way. So the vaccine really is still doing its job.
Dr. Ivanaviciene, what percentage of the patients in your hospitals right now, in your health system, would you say are breakthrough cases at the moment? And is there any data in terms of the prevalence of the Delta variant as far as I know Dr. Hahn just addressed it, but the Delta variant in terms of these breakthrough cases?
So we do see some breakthrough cases, but as Dr. Hahn mentioned earlier, most of the people who present, they are either asymptomatic and they got tested because somebody else in the family who were not vaccinated had symptoms, or they have very, very mild symptoms and they just come for testing in emergency department. We also, what we see, the people who get admitted and the people who get severe disease, I would say 99.9% in our healthcare system, they are unvaccinated. So I would urge people to get vaccinated and kind of slow down this transmission. And I think people have to understand that vaccine is really, really helpful in preventing this pandemic to forward exploding. And I just want to say that if we are not going to vaccinate each other, the virus will continue changing. We'll see new variants that at some point our current vaccines will not be working. So we will have to start everything all over. We'll go back into pandemic and we'll have a lot of issues. So I would like to recommend people to think about it that, vaccine adverse effects occur very rarely, severe adverse effects, and they should think about vaccinating themselves to prevent their loved ones.
Dr. Hahn, I want to talk about this recommendation from the American Academy of Pediatrics this week, and I want to get both of you to weigh in on this because the Academy is recommending that anybody who's 2 and up, vaccinated or not now, should be masking up when they return to school in the fall. And so we're talking about children, we're talking about staff and teachers as well. Do you think that the CDC should adopt this stance just based on your own experience with COVID?
So I'm sorry, you broke up there for, I didn't even know if that question was addressed.
Yes, it was. It had to do with the American Academy of Pediatrics recommending that anyone 2 and up, vaccinated or not, should be wearing a mask in school in the fall. Do you think that the CDC should adopt the stance?
I think that children are, they are still unvaccinated. So there is still a risk of spread amongst children at school. It seemed that in our area here, children that were going in person were masking, keeping their distance, did seem to allow in-person learning pretty effectively. Now, their teachers can get vaccinated, but the kids themselves that are less than 12 are still at risk of getting the illness. And I think that we probably think about children getting COVID as a less severe form than the adult form, which is true, but it doesn't mean that it's a zero risk for the child and that they aren't also at risk for severe complications. So I have 4 children. My oldest is 7, so none of them are vaccinated. And I would be supportive of them wearing masks and distancing at school. It worked last year and it kept them safe. Whether or not the CDC should weigh in on it, I think they should look at the evidence and make their best recommendation.
All right, Dr. Han, Dr. I, thank you so much for joining us. You're both a wealth of knowledge, and we thank you so much for weighing in on the conversation tonight. Thanks again.